Hi everyone, my name is Praveen. I'm a PGY1 at Crozier-Chester Medical Center. Thank you, SAGES, for having me here today. Today I'll be presenting a study that me and my colleagues conducted to investigate online websites for minimally invasive surgery programs. The authors have no conflicts of interest or disclosures today. So the inspiration for this study actually came from me going to MIS program websites to see what kind of information was available. I found some information, but there were a lot of lacking areas that we wanted to investigate. A bit of a brief background on the MIS fellowship website process. It began in 1991 with the creation of MIS fellowships at the University of Maryland. In 2004, the Fellowship Council was created to create an organized match for everyone. Since then, the process is becoming more and more competitive with only a 68% match rate in the 2021 cycle. Based on my findings on the online information and other applicants, there's a clear mismatch between applicant demand for MIS fellowships and what's actually available on the fellowship websites that needs to be addressed. In this study, we looked at 92 programs identified on the Fellowship Council website. We screened them for 12 pre-identified variables that were based on previously published literature identified as being important to general surgery residents applying to the MIS fellowship. We also analyzed these websites for geographic variation based on program as well as academic rank variation. The results were a lot. The first is that 38% of the fellowship websites had less than 50% of the pre-identified variables shown in the previous slide. In fact, only 2 websites had all 12 of the variables present. The table to the left shows that there was a statistically significant difference in geographic variability of information. The South, the West, and the international regions had a higher number of pre-identified variables present. The middle pie chart shows that certain geographic areas with more programs actually had less pre-identified variables compared to others. And then lastly, the table on the right shows that there was no statistical significant difference between US News ranked top 25 programs and not top 25 ranked programs based on the number of pre-identified variables. This is just a summary slide of all the factors that were present. The main takeaway here is that on average, only 54% of the pre-identified variables were present on the average website. In summary, it's been shown on the literature that general surgery residents value program websites when evaluating MIS fellowships. Second, as seen in the slide before, the main areas that were lacking were benefits and career development, fellow faculty support, and case volume information, which has also been shown to be highly important to general surgery residents themselves. Lastly, the main goal of this study was to show that there is an opportunity for a stronger match for both programs and applicants. And by adding some of this information and tweaking the websites, I think that the match can be bettered. Thank you. I'd be happy to take any questions.